how do you know what kind of treatment at what stage in my control of asthma is required? We like to deliver you an asthma action plan. And what it means is a piece of paper. We also do some peak flow meter checking in the clinic, and it is a tool for you to have at home to have your asthma control assessed. And all you need to do is to blow into this hollow tube as fast as you can, as hard as you can, with one swing. And you can see on this axis, the y-axis, there is the measurements here, which is 200. Hello, I'm Professor Dr. Syed Arshad Husain. I'm a professor in pulmonology, adjunct in Gulf Medical University, UAE. I'm also a senior consultant pulmonologist at the King's College Hospital. And a lot of people do ask me this question: how do we pick up that our asthma control is going bad? How do we know what kind of treatment at what stage in my control of asthma is required? So the modern care of asthma does make it more a personalized care for asthma patients. So in order to do that, we like to deliver you an asthma action plan. And what it means is a piece of paper where we have your details, which is your name, we have your date of birth, and perhaps your phone number and home address, so your demographic. Plus, we want to write up what kind of inhaler treatments you are on currently, or what type of treatment do you use. We also do some peak flow meter checking in the clinics, and we do exhale nitric oxide checking, the pheno check. And all these things are important to document down on this one piece of paper called the asthma action plan. Because why this is important is when things do deteriorate, we can always measure deterioration, or we can pick up early if things are changing. The advantage of this asthma action plan is immense. It prevents patients with asthma about 4 times if they have this action plan, that they do not require emergency visits. This prevents them requiring emergency care and emergency visit, or having exacerbations of their asthma. So it is a very vital document to have at home, and it should also have your doctor's details, so that in any case anybody wants to contact the doctor, they can. But the most important device which I give to my patients when they come to see me in the clinic is this device, and it is a tool for you to have at home to have your asthma control assessed and measured without requiring to come to my clinic or contact me. So let's see what this is, what device it is, because people do ask a lot of questions about this device, how to best use it. So let's see this device open up in this format, and you open this. So basically it is what is a hollow tube. It's called peak flow meter, and all you need to do is to blow into this hollow tube as fast as you can, as hard as you can, with one swing. So when I do that, I'm not doing it, but if I do that, it will give me some reading, or if you're doing it, you'll get some reading. It's very important to look at this reading, what score you're getting. You're getting about 225 on the meter reading here. And once you've seen what readings you're getting, ideally you should take the 2 readings at one go and take the best out of the 2 readings and document on a graph. And the graph is called a peak flow meter diary. I will show you what it looks like. So this is a graph which is the asthma peak flow meter diary, and you can see on this axis, the y-axis, there is the measurements here, which is 200, 240, 260 liters per minute. So on this side is showing morning and evening, and it's 1 day, 2nd day, 3rd day, 4th day, 5th day. So what we're doing is, with this device, we're doing measurements of your airway size, and you are then jotting down the reading you're getting onto this graph at whatever score you're getting. So say for instance your score is 200 on the morning, you score somewhere here, the 200. So around the 200 mark, you put a dot or a cross. I'll show you how it's done further to clarify this. You see this is the morning reading. I'll show you the pen. Morning reading, evening reading, morning reading, evening reading. So morning reading again, evening. So you're showing 2 readings in 1 day, and this is out of the 2 readings, you take the best score and put it as a dot there. So you can see a wavy pattern. This shows variability of the size of the airway, which favor a diagnosis of asthma. Asthma is a variable disease of the airways. And so this is showing variability, and that's what shows on me, just looking at the graph, that this patient has asthma. But if you carry on looking at the variability, you see the patient has started inhalers here somewhere in this stage. Is it day 7, I think. Day 7, he started the inhaler treatment, and you can see the difference it's doing. It's increasing his peak flow measurement. So it's going up and up again. But the other thing to notice is that he's not having that big variability that he started with. It also suggests that asthma is being treated properly and things are improving. So this is a very highly important tool along with the peak flow meter to have at home and to be able to use and assess your readings. Now people say, how would we know? Because 10-day period before an exacerbation for asthma is the most vital important time period. And you could pick up that you're going to have an exacerbation of your asthma, or your asthma control is going to become bad. And this 10 days before the event is vitally important. And if you feel your symptoms are changing, or you're having more cough, more shortness of breath, especially if you're having nighttime symptoms, please use this device that you have at your home, at your disposal. And it comes to 0 like that, and then you blow into again, and it gives you a reading. Now you have to know what is your best reading and what is your lowest reading. When the reading starts to go near the lowest readings or below the lowest reading, you know that your asthma control is becoming bad. Equally, the way to look at is, if your score is about 50 to 70% of your usual peak flow meter charting, then you have a kind of a slight less control, or more or less a good control. But if you go into between 50% to 33% of what is your normal scores, that suggests that you have bad asthma. So the asthma control is not good. But if this score is going as low as 33% of what is normally what you score, if you're going as low as 33%, I make it very clear, this suggests that there is an imminent attack of asthma going to happen. You're going to become very, very unwell. So you need immediate attention from a doctor or some help from them. So if it's severe, it's less than 33% predicted. If it's kind of less severe, 50 to 33%. And if it's scoring between 50 to 70%, it's usually mild asthma, and the asthma control is not too bad. So these are important things to understand about the peak flow meter charting and how you do it. My patients have sent these charts to me, and I have some of them sitting here. And just for the sake of seeing how people score, how people do, some people do crosses, and then morning and evening, morning and evening. And obviously, sometimes the control of the asthma can go worse if you're developing an infection. And how would you know that you're developing a chest infection? You start to run a fever. This is most important thing to understand. Or people do start to have nighttime symptoms, bring up more phlegm. The color of the phlegm, the consistency of the phlegm, and the amount of the phlegm, it changes. That suggests that you're developing a chest infection. It's a guide for you at home, plus your peak flow meters.